Our project is about obsessive compulsive disorder, and our movie is What About Bob?
There are two types of people in this world. Those who like Neil Diamond and those who don't.
What is the crisis, Bob?
My ex-wife loves him.
Just when patient Bob Wiley was making progress,
Dr. Marvin, you can help me.
Dr. Leo Marvin was making other plans.
As of this afternoon, I'm taking my family on vacation until Labor Day.
But Leo's vacation
Dr. Marvin!
is about to become
Dr. Marvin!
Bob's therapy.
Oh, I really appreciate this.
I do not see patients on vacation, ever.
We just got to figure out a way to work around your schedule. 2 to 4, 3 to 5, Monday, Wednesday, Friday, Saturday, and Sunday.
I don't want any of you letting Bob into this house.
He's a sweet guy. Could we invite Bob over for dinner? Would you like some more chicken, Bob?
Faye, this is so scrumptious.
Will you stop that, please?
Now, while Bob is getting better,
Roses are red, violets are blue. I'm a schizophrenic, and so am I.
Leo is taking a turn for the worse.
You're angry.
No, I don't get angry.
When you're upset.
Relax, Leo. Take a vacation.
I'm on vacation!
Touchstone Pictures presents Bill Murray
Hello, I'm Bob. Would you knock me out, please?
and Richard Dreyfuss
Don't you understand? This man is crazy!
in a totally insane comedy.
You've turned a perfectly peaceful house into an insane asylum! Get out!
Why'd you need to kick Bob out of the house?
He's not gone. That's the whole point. He's never gone!
Is this some radical new therapy?
You see?
What About Bob?
What are you doing with the rifle?
Death therapy, Bob. It's a guaranteed cure.
Klein is Bob Wiley. He's a 40-year-old white male. His marital status is divorced because he couldn't handle the fact that his ex-wife loved Neil Diamond. He has no children and lives with his goldfish Gil, who he talks to, and he is presumably unemployed.
In a mental status examination of Bob, his appearance, speech, and eye contact appeared normal, his motor activity was restless, and his affect was full. His mood was euthymic and anxious. He showed no signs of orientation and memory impairment, and his attention was normal. He showed no signs of hallucinations, derealization, and depersonalization. His behavior was cooperative, paranoid, and bizarre, and he had good insight.
Why exactly are you doing this?
If I fake it, then I don't have it. You know, it's the same with the cardiac arrest. Oh!
Bob's family structure is that he is divorced with no children. He's presumably unemployed based on the beginning where he is seen telling Gil that he is off to work, but then sits down at his desk in his apartment and clocks himself into his own time card. He has no identifiable social supports, and he only talks with his fish named Gil. His risk factors is that he lacks a support system, and his strengths are that he is personable, fun, has a willingness to help himself, and is very cooperative with treatment.
DSM-5 diagnosis, obsessive-compulsive disorder. Repetitive behaviors or mental acts that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Example, I feel good, I feel great, I feel wonderful. The obsessions are time-consuming or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Example, Bob is unemployed. The obsessive-compulsive symptoms cannot be attributed to the psychological effects of a substance. The disturbance is not better explained by the symptoms of another mental disorder. Bob has OCD with good insight because he recognizes that the obsessive-compulsive disorder beliefs might not be true.
I feel great. I feel wonderful. I feel good. I feel great. I feel wonderful. I feel good. I feel great. I feel wonderful. I feel good. I feel great. I feel wonderful.
An alternative diagnosis for Bob would be agoraphobia, a fear of places and situations that might cause panic, helplessness, or embarrassment. The first sign and symptom is a marked fear or anxiety about 2 or more of the following 5 situations. Using public transportation. An example would be that Bob uses a tissue to touch anything in public. Being in closed spaces. An example would be Bob walks up 24 flights of stairs to avoid standing in the elevator. 3. Standing in line or being in a crowd. An example would be when Bob begins his repetitive, I feel good, I feel great, I feel wonderful, while he walks to Dr. Marvin's office in the crowded city. 4. Being outside of the home alone. An example would be Bob goes to extreme measures to reach Dr. Marvin because he's not confident that he can do anything without his reassurance. B. The individual fears or avoids these situations because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms. C. The agoraphobic situations almost always provoke fear or anxiety. D. The fear, anxiety, or avoidance is persistent, typically lasting for 6 months or longer. E. The fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, an example being Bob is unemployed. F. The fear, anxiety, or avoidance is not better explained by the symptoms of another mental disorder.
Baby steps, get on a bus. Baby steps, get on a bus. Baby steps, focus.
Hello, I'm Bob. Would you knock me out, please? Just hit me in the face.
Our 3 nursing diagnoses are anxiety related to perceived threat to self-concept, exposure to phobic stimuli. This is our priority nursing intervention. Our next diagnosis is ineffective coping related to personal vulnerability and unmet dependency needs. Our last diagnosis is fear related to phobic stimulus, being in a place or situation from which escape might be difficult, and causing embarrassment to self in front of others. Our priority nursing diagnosis is anxiety, which is a vague, uneasy feeling of discomfort or dread accompanied by an autonomic response. This is related to perceived threat to self-concept and an exposure to phobic stimuli, as evidenced by restlessness and fear of doing something uncontrolled during an attack. Subjective data from Bob is I get dizzy spells, nausea, cold sweats, hot sweats, fever blisters, difficulty swallowing, difficulty breathing, blurred vision, involuntary trembling, dead hands, weak ankles, twitching, fainting spells, numb lips, and I'm just worse than usual this time, really bad. Objective data is Bob's restlessness during his initial interview and shaking and trembling when he is calling Dr. Marvin on the phone. A short-term goal for Bob is that the client will be able to verbalize ways to intervene in escalating anxiety within 1 week. A long-term goal will be for the client to be able to recognize symptoms of onset of anxiety and intervene before reaching panic stage. The main nursing intervention will be to teach the client signs and symptoms of escalating anxiety and ways to interrupt its progression, such as relaxation techniques, deep breathing exercise, physical exercise, jogging, and meditation. The client will determine which method is most appropriate for him. The rationale behind this is that relaxation techniques result in a physiological response opposite that of anxiety, and physical activities discharge excess energy in a healthful manner.
But when I want to go out, I get weird.
Talk about weird. Talk about weird.
Well, I get dizzy spells, nausea, cold sweats, hot sweats, fever blisters, difficulty breathing, difficulty swallowing, blurred vision, involuntary trembling, dead hands, numb lips, fingernail sensitivity, pelvic discomfort.
Our nursing diagnosis of ineffective coping is the inability to form a valid appraisal of the stressors, inadequate choices of practice responses, and/or inability to use available resources. related to personal vulnerability, unmet dependency needs, as evidenced by inability to meet role expectations. The subjective data is gimme, 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 please, please, please. The objective data is Bob can't make effective decisions when he finds out his doctor is going away on vacation, so he tracks down his doctor to find where he is. A short-term goal that we have is within 1 week, client will decrease participation in ritualistic behavior by half. A long-term goal is by time of discharge from treatment, client will demonstrate ability to cope effectively without resorting to obsessive-compulsive behaviors or increased dependency. One intervention we have is gradually begin to limit amount of time allotted for ritualistic behavior as client becomes more involved in other activities. The scientific rationale is anxiety is minimized when client is able to replace ritualistic behaviors with more adaptive ones.
But can't we just have a little talk?
Bob, you are testing my patience.
Come on, I've come so far.
Bob.
I'm baby stepping.
Bob.
I'm doing the work. I'm baby stepping. I'm not a slacker.
Listen to me.
Check it out. Look at I'm in really bad shape. Come on, please,
Bob.
please.
Bob.
Give me. I need.
Bob.
Give me.
Okay.
Our third nursing diagnosis is fear, a response to a perceived threat that is consciously recognized as a danger, related to phobic stimulus, being in a place or situation from which escape might be difficult, and causing embarrassment to self in front of others, as evidenced by refuses to expose self to certain phobic objects or situations, symptoms of apprehension or sympathetic stimulation in the presence of a phobic object or situation. The subjective data is when Bob says, I get dizzy spells, nausea, cold sweats, hot sweats, fever blisters, difficulty swallowing, difficulty breathing, blurred vision, involuntary trembling, dead hands, weak ankles, twitching, fainting spells, and numb lips. And then when he says, what if I break my neck and become paraplegic? What if my heart stops beating, or I can't find a bathroom and my bladder explodes? The objective data is that Bob uses a tissue to touch anything in public, he ducks down at the sight of a bus driving by him on the street, and he runs up 24 flights of stairs to get to Dr. Marvin's office because he is too afraid to take the elevator. A short-term goal for Bob is the client will discuss the phobic object or situation with the healthcare provider within 1 week, and a long-term goal is by the time of discharge from the treatment, the client will be able to function in the presence of the phobic object or situation without experiencing panic anxiety. The most important intervention for fear is to discuss the reality of the situation with the client in order to recognize aspects that can be changed and those that cannot be changed. The rationale for this is the client must accept the reality of the situation before the work of reducing the fear can progress.
So the real question is, what is the crisis, Bob? What is it that you are truly afraid of?
What if my heart stops beating? What if I'm looking for a bathroom, I can't find it, and my bladder explodes?
This is our concept map with all 3 of the nursing diagnoses listed, with the primary one being anxiety. This also lists our medications such as Valium, Halcyon, and Seconal with all of the listed side effects. Some of the ethical and legal issues in this movie include that Dr. Marvin seems to be uninvested in Bob from the initial meeting. He is only focused on his interview with Good Morning America regarding his recently published book. He gave Bob a copy of the book even though it is not relevant to Bob's condition, and then he charged him $30 on top of his introductory interview. Bob goes to extreme measures to meet with Dr. Marvin while he's on vacation by calling him, pretending to be his sister, faking his own suicide, and eventually locating their vacation home and actually traveling there to meet with Dr. Marvin. Dr. Marvin's own neurotic and egocentric personality leads him to unethically and involuntarily hospitalize Bob in order to get rid of him. When that fails, he tries to kill Bob by tying him up in the forest with explosives.
Because it's time, and I'm ready. With Dr. Carswell Fenstewald, I wasn't ready. With Dr. Rosengay and Benchesky, it wasn't time. I certainly wasn't ready for Mallerstein or Miller or Hill. But with you, finally, I'm ready.
The only significant difference between those other guys and me, Bob, is that I'm gonna kill you.